8 billion. In 2023, there are 8 billion human beings on Earth. It's a staggering number. 8 billion people wake up every day with hopes and ambitions for their future. For far too many of those 8 billion, those futures are in jeopardy due to poor access to quality health care. It is the mission of our institute to remove that barrier to human potential. The Robert J. Havey Institute for Global Health is the worldwide leader in providing the resources and personnel needed to ensure that underserved populations around the world can thrive in the face of challenges unsolved and newly evolving. We collaborate with partners, doctors, researchers, and healthcare workers from every field of study to create cutting-edge, localized, and long-lasting solutions to the many problems facing these populations in low and middle-income countries.
When we started over 15 years ago, we had just about 30 faculty. Now we're at 400.
Our goal here is really to avoid any kind of one-off situation, to develop the capacity in our partner countries, get them to a point where they become really sustainable, and that we work together on an equal basis.
The relationships get stronger every year because we do more work together. It's pretty amazing when you hear the stories of the sort of care that's available to most of the population around the world, and you see how relatively simple it is to upgrade that.
4.5 million people live in the eastern Visayas region of the Philippines. Despite a large population, the closest hospital for obstetrics and gynecologic care is over 100 kilometers away, a 3-hour drive each way.
With funding from the Institute for Global Health, the local Salcedo Doctors Hospital is being transformed into a regional center for women's health.
With equipment upgrades, protocol enhancements, and a longitudinal relationship with Northwestern, the center will become a central place for women to receive quality health care that was previously not accessible, and a place where healthcare providers can be empowered to develop expertise and meet the needs of the greater community.
Hepatitis B is a viral infection that affects 300 million people and leads to 1 million deaths worldwide. Dr. Claudia Hawkins from the Institute's Center for Infectious Disease has been studying this problem for years.
Chronic hepatitis B infects over 60 million people in sub-Saharan Africa every year, often resulting in complications such as liver cirrhosis, cancer, and death. These complications are accelerated in the presence of HIV, which is also very common across the continent. Our project seeks to create a network of clinical research sites across sub-Saharan Africa to better understand persons with chronic hepatitis B.
Ophthalmic care is something we take for granted in high-income countries, but even simple screening for vision impairments is rare in many parts of the world.
Over 80% of blindness in Kenya is due to treatable and preventable causes. Our project uses an innovative smartphone application to help screen for these issues within the community. By identifying at-risk patients in the community, they can be brought into the healthcare system earlier and greatly increase their chances of avoiding long-term damage from easily treatable conditions.
This project was designed through the Ryan Family Center for Global Primary Care, in partnership with the Notre Dame-sponsored Brother Andre Medical Center in Kenya. The team was assembled to go into the community using this smartphone app to find vision-impaired people and link them with ophthalmic care, allowing many to achieve healthy vision for the first time in their lives. The Institute started with the mission of training the next generation of global health experts. Working with the Kellogg School of Management and the McCormick School of Engineering and the Institute Center for Innovation in Global Health Technologies, they're helping students understand how building and marketing medical devices needs to be undertaken in the context of the culture and environment in which they are working.
Our team is working on a low-cost breast biopsy device.
Our project is specifically focused on how we can use AI to better screen for cervical cancer.
The students obtain feedback on those innovations from a wide variety of stakeholders.
They're really learning how to design for a particular population.
Having technology that is able to impact health outcomes requires many skills.
The drawback with this device is that it's extremely expensive.
The scholarship really made it possible for a lot of our team to be able to travel to South Africa from so far away, and really enables us to immerse ourselves in a new country and the global health landscape.
In sub-Saharan Africa, most women do not have access to screening for cervical cancer. They only discover they have cancer when the disease is already advanced and incurable. Working with Dr. Li Fang Hao in the Center for Global Oncology and with the generous support of the John R. Flanagan Charitable Foundation, the Institute is designing a self-test protocol allowing women to test themselves for HPV, resulting in large-scale identification of the population of women most at risk for this preventable cancer. In many parts of the world, those with terminal diseases like cancer do not have access to any end-of-life care services, leaving these patients and their families without any experienced palliative care experts to help ease the suffering that affects so many at the end of their lives. This is especially tragic for terminally ill children. Through the Center for Global Health Education, our faculty are creating a program to address this critical need.
Access to high-quality palliative care should be a reality for everyone, everywhere. However, it is scarce in Lagos, Nigeria, a city where millions suffer from advanced cancers and chronic diseases. Making a referral to palliative care. So that's like a systemic intervention that can really help. And based on our findings and known best practices, we launched a palliative care pilot service at Lagos University Teaching Hospital just this past summer.
At the Bugando Medical Center in Mwanza, Tanzania, there are currently no pediatric cardiologists, despite a large burden of congenital and acquired heart disease in children. Through a long-standing partnership in Bugando, the Institute for Global Health was called in.
Through a partnership with the Bugando Medical Center in Tanzania and Chicago's very own Lurie Children's Hospital, we are implementing a program to provide annual echocardiogram training to local providers. This will build capacity to increase availability of trained providers locally who can perform echocardiograms to diagnose congenital heart disease, evaluate the function of the heart, or assess the heart for other diseases.
Using these in-person workshops given world-class Lurie experts, local faculty will be much better equipped to meet the needs of underserved children. In the country of Ukraine, we have been working for several years to train local surgeons in techniques to lower the incidence of post-operative infections. Since the outbreak of the war, our team's efforts have been especially critical. We're helping to provide life-saving surgical procedures for Ukrainian refugees, and also bringing surgeons from that country to Northwestern to help further their own training. This relationship is yet another example of the partnerships fostered by the work of our Global Surgical Center at the Institute. Since the emergence of COVID in 2019, genomic surveillance has helped researchers monitor the variants of this virus as they appeared, allowing better and faster development of treatment tools, such as vaccines and antibodies. Unfortunately, some countries simply lack the ability to do this critically needed viral analysis. For example, Of all variants sequenced around the world, only 2% were studied in South America. Researchers at our longtime partners in Peru and Bolivia simply did not have training or infrastructure to unravel the genetic sequences of the viruses and bacteria affecting their own populations.
Our project proposes to establish partnerships with 3 cities in South America to fill critical gaps in that surveillance. The proposed network in Lima and Iquitos in Peru and Santa Cruz in Bolivia will generate critical data collection in less research communities and contribute to local and global COVID surveillance capacity.
It's easy to become discouraged because we have so much work to do. If you want to get a bit pessimistic, you could just throw up your hands and say that the world's a mess and it's getting messier, and that we'll never have the kind of impact that's necessary to solve even a small proportion of all the problems that exist.
We can't just go sit back on our laurels and just face the crisis as it comes. We have to work with sentinel projects around the world to keep our finger on the tab of what's happening where and when. You just don't flick a switch and get those kind of people. You really have to build them. That will really solidify our position to keep this thing going in a sustainable fashion.
The task is great. Our efforts must be even greater. By leveraging a vast range of expertise and a pool of unparalleled talent, the Institute of Global Health is making ever greater progress in addressing the challenges you see every day. All of it is made possible with an equally committed pool of supporters who share our ambition and our vision. Together, we are ensuring good health for those 8 billion people, today and far into the future.